Hello, William and Mary. Thank you for joining us for a very special community conversation. Our guest today is Dr. Anthony Fauci, our nation's top infectious disease expert and chief medical advisor to President Biden. Dr. Fauci was appointed director of the National Institute of Allergy and Infectious Diseases in 1984. He oversees an extensive portfolio of research to prevent, diagnose, and treat infectious diseases, established and new ones, such as HIV/AIDS and respiratory infections, as well as emerging diseases such as Ebola and Zika. My first memory of hearing his name is the work that he led in raising awareness of AIDS and the imperative to defeat that epidemic. This country owes him for many decades of pioneering scientific advocacy. For our liberal arts students, it's wonderful to know that Dr. Fauci began his career in medicine with a degree in classical studies. That's our crowd. And we're really grateful, Dr. Fauci, that you've generously volunteered your time to speak with us today. We have received hundreds of questions for you. As Student Assembly President, Tony Joseph and I are going to pose as many as we can today, spending about 30 minutes in Q&A, and then we'll close out with a lightning round of questions. But I thought I'd kick us off, Dr. Fauci, first just by saying welcome. Thank you for joining us.
Thank you. Thank you for having me.
I'm going to briefly introduce William and Mary to you by saying a few things about where we are now as a university in our own COVID-19 experience, and then kick things off. This past fall, William and Mary had a very low number of positive cases on campus. We were humble and incredibly fortunate and very, very dedicated as a campus. We went all in on robust testing. In fact, very much thanks to some things that you said in the summer, mandatory mask wearing and other public health steps that you've recommended since the pandemic began. Today, our numbers are still very low compared to what we're seeing in the region, a little bit higher, which is what we expected for this state of pandemic. But our testing protocols are very robust. We have a public health advisory team composed of our 2 faculty epidemiologists and 2 physicians and our chief operating officer and the head of our data gathering and testing. They look at the data multiple times a day, and their analysis is guiding our decision making. We have a really strong town-gown partnership with the city of Williamsburg that has allowed us together to establish shared norms of behavior and mutual care in this community. And we have an amazing student body that is so focused on community. We see nearly 100% mask wearing on campus. And so one of the reasons that we're incredibly pleased to speak with you today is that we are focused on the science. That's what is driving our decision-making and our actions. It's a community here that's really interested in hearing from you what we know about the virus and the spread of COVID-19 so far. What are the most important gaps in knowledge? What gains do you want to see in the next 6 months? And especially, what actions can we take that matter in slowing the spread? So I'll kick you off with those questions.
Well, first of all, thank you very much for having me. As you know, just from the experience that we've had over the last more than a year now, the COVID-19 pandemic is historically the worst pandemic of a respiratory disease that we've had in 102 years, dating back to the iconic and terrible influenza pandemic of 1918. This is a very unusual virus, unique in so many ways that in all the experience that I've had in dealing with emerging and re-emerging infections, I've never seen a virus that is so contrary in what you would expect. Let me explain. So about 35 to 40% of the people who get infected have no symptoms. Of those who have symptoms, about 80% have mild symptoms that don't require a particular intervention, namely hospitalization. But about 20 to 25% of the people get sick enough that you have the 470,000 mortality that we've seen such far, which, as you know, is considerably more than what killed in World War II. And right now, as you and I are speaking, Madam President, it is the leading cause of death in the United States. That is absolutely extraordinary. It's respiratory-borne virus. It has an extraordinary capability of spreading from person to person. We've seen multiple waves in this country. The first wave, you recall, was in the late winter and early spring of 2020. That was mostly dominated by infections in the northeast part of the country, dominated by the New York City metropolitan area. That went down a little, but the big issue that has permeated the situation in the United States, making it different from other countries, is that we never got below a reasonable baseline. Even when we went past the peak in New York, we went down to about 20 to 30,000 infections a day. Then, as you recall, we tried to open up the economy in the early summer of 2020. The problem is that many states did not abide by the recommended way of opening up, namely gateway, phase 1, phase 2, phase 3. And what we had was another surge that when it finally peaked, it came down to about 70,000 per day, which is totally unacceptable, far greater than any other country in the world. Then, as the cold weather set in, and we had the holiday season of Thanksgiving, Christmas, New Year's, we had an exponential increase in cases to the point of having 300,000 or more cases a day, 3,000 to 4,000 cases a day, and hospitalizations that almost overran the system. Fortunately now, we have a dramatic diminution going down, but we can't be complacent about that because there are variants, namely mutations, that could in fact turn it around again. The one roaring success story, which I'm sure we'll get a chance to discuss in this entire situation, has been the extraordinary success of the vaccine program, with now multiple vaccine candidates that are 94 to 95% effective, which is a testimony to the extraordinary advances that have been made in science, the science of platform technology, structure-based vaccine design, et cetera. So let me stop there, and I'm happy to continue on by answering questions.
Thank you, sir. And thank you for that wonderful overview. And as Dr. Rowe said, we received hundreds of questions and concerns from students who are really want to know the details, the fine points that you were mentioning. And going into that, you said nationally, we've seen COVID cases dropping significantly over the last 2 weeks, but an increase in that mortality rate. And what is that data? Can you go more into that data? What is it telling us about this drop and increase?
Well, you know, one of the things that fooled us throughout, there is always a couple of week lag between an increase in infections and an increase in hospitalizations, and a 2-week lag between the increase in hospitalizations and an increase in deaths. That's on the way up and on the way down. So on the way up, you could have a lot of new cases, but not a lot of hospitalizations and deaths. Then when the cases peak and come down, you still have an increase in hospitalizations and deaths until it equilibrates. So what we're going to be seeing very soon is a significant diminution in hospitalizations and deaths. We're already seeing dramatic diminutions in hospitalizations. The deaths are going to soon follow that.
So I guess on that lines, when could we expect to begin seeing data on transmission rates among vaccinated people and whether the vaccine provides that sterilizing immunity that we're seeking?
Well, one minor correction, Tony. It's not sterilizing immunity, because we know it prevents you from getting clinically ill, the vaccine. We don't know if it prevents you from getting infected. So we don't know if it gives us sterilizing immunity. It might, it could be, but we don't know that yet. We'll likely know that in follow-up studies that will be, I would say, a few months, a couple of months from now. The situation that if you want to have a complete lockdown on cases, you would have to get what's called herd immunity. Namely, you have such a high percentage of the population gets infected that gets vaccinated, gets vaccinated, that the degree of infection in the community is so low because the virus has no place to go because most of the people are already vaccinated. That's what's called herd immunity. However, you can start to see a dramatic diminution in the number of cases based on early results of vaccines. For example, if you get 30, 40, 50% of the population vaccinated, even though you haven't reached the 85% of people vaccinated that you would need for herd immunity, you could still have a dramatic effect on diminishing the number of new cases. This is exactly what's going on in Israel right now. Israel is vaccinating not 85% of the people yet, but a substantial proportion. And with that, the number of cases, of new cases, has dramatically diminished.
And I guess to that point, on topic of vaccinations, one of the questions that a lot of William Mary students and families are interested in, because we made the decision at William Mary to maintain all safety requirements on campus, including masks in those public spaces, as President Rowe had mentioned. So on those vaccines, what's the latest on when college students will be able to access those vaccines?
Well, that's a good question. If you consider not the college students who have an underlying medical condition, but an otherwise healthy 20-year-old college student, the chances of that person getting a vaccine, it likely will not be until early May, mid-May, late May. I thought it was going to be April. And in fact, I was on the record of saying that it would likely be open season somewhere in April. But one of the disappointments to make me change that estimate is that the J&J vaccine, which we anticipated would be coming in significant quantities in March and April, we learned that they will not have significant quantities until likely May and June. So I'm going to have to modify that estimate to say somebody like yourself, a young person, apparently otherwise healthy, likely would have to wait until May rather than April, which I originally had said.
Those are important dates for us to internalize, May rather than April, as we chart this course. And I think another thing which could help dispel some rumor and concerns that students have, once a person is fully vaccinated and is in contact with someone COVID positive, can this person be a carrier and pass the virus to others? Is that still a possibility?
Yes, it's theoretical possibility. How likely that is, we do not know, and we will find that out as we continue the follow-up studies, because the endpoint, the primary endpoint of the clinical trial that determined that the vaccines were 94 to 95% effective were based on the ability to prevent clinically apparent disease, namely symptomatic disease. So it is conceivable that because you're vaccinated, you still get infected, but the vaccine protects you from getting clinical disease, and you're infected, you don't know it, you have virus in your nasopharynx, so conceivably you could transmit it to someone else, even though you have no symptoms at all. That's the reason why we say, even though you've been vaccinated, you must continue to wear a mask when you're in the presence of people who have not been vaccinated in order to prevent you, theoretically, from infecting them.
And to that point, there are concerns of those who are immunocompromised or otherwise. Should they not get vaccinated? Are there long-term effects to consider?
No, great question, Tony. I'm glad you asked it. Absolutely, they should get vaccinated, because the only reason not to vaccinate an immunocompromised person would be if you were dealing with a live attenuated vaccine that could continue to replicate and be a safety issue. There's no safety issue with immunocompromised people. The only thing is you may not induce as robust a response because their immune system is compromised, but a less than robust response is better than no response at all. And that's the reason why I would encourage people for example, who have rheumatological diseases and are on prednisone or some other immunosuppressive drug, they definitely should get vaccinated.
And I guess, you know, for someone like me who's trying to talk to their friends and encourage them to get the vaccine, and there's a lot of distrust out there and different information that people are hearing, do you have any strategies or advice for encouraging those people to go and get vaccinated, particularly those who do not trust it?
Well, you know, it depends on what the reason for the vaccine hesitancy is. In your dealing with African Americans, there is this historical issue that just won't go away. And that is decades and decades ago, before most young African Americans were even born, there was the disgraceful Tuskegee situation where the federal government did a series of studies on syphilis and were egregiously unethical studies. Now, that gets passed from generation to generation. So you were not born during the Tuskegee, but I'm sure you heard about it from your grandfather and your father and your mother, no doubt. So what you've got to do is first respect the hesitancy that relates to that, because that's a good reason to be skeptical. But at the same time, to explain to people that since then, ethical constraints have put into place in the form of institutional review boards and data and safety monitoring boards that would make that type of unethical behavior completely impossible to happen. Once you establish that, then you go through the things that make them hesitant. They say, well, you know, you did it really quickly. It usually takes years to get a vaccine approved. How could you possibly get it approved in 11 months? Well, the reason is it's a reflection of the extraordinary scientific advances that were made over the previous 10 to 15 years. It's not compromising safety, and it's not compromising scientific integrity. Then the next question is, well, how do I know it's really safe and effective? Is this the federal government lying to us, or is it the pharmaceutical companies that just want to make a lot of money? Well, what you can then tell them that the determination of whether it's safe and effective is made by independent bodies of data and safety monitoring boards that have absolutely are beholden to no one except the general public, so that the decision is both transparent and both independent. So once you get that established, hopefully you'll win over some of your colleagues who are hesitant.
Certainly, that's sound advice, sir. Thank you.
Really, really wonderful questions. I want to frame them with some big picture questions now. And I think I'll start from the speed at which knowledge has evolved about the disease and about the virus itself. We spoke with a wonderful alum a week or so ago who's been involved in developing the Moderna vaccine. And she said, as much as you have, it sits on a decade of research about how RNA works, and as do our tests, for example. I'm interested in what information do you wish you had now? What is it that would make the biggest difference in knowledge and in our ability to respond to the spread of COVID-19?
Well, you know, there are a few things. One of them is that what we don't know is the durability of the response. We don't know how long someone would be protected against infection with the vaccine. It would be really important to know that now, because then we'd have to plan about when we would give a person a boost to make sure that you have duration of their immunity. So of all the things from the standpoint of a vaccine that we'd like to know, I don't think there's much concern about the long-term adverse events, because it looks like it's a pretty safe vaccine. So I wouldn't be worried about that. There have been some allergic reactions, particularly people who have a history of anaphylactic reaction. But other than that, there really hasn't been much concern.
What role do you think universities play here? We know we play a critical role in sharing facts and combating misinformation. In your view, how could a place like William and Mary help dispel rumors and set the record straight on public health matters related to the pandemic?
Well, there are a couple of ways. I think, but what you just said, what you did in your own university, why you did so well, because you followed by example the public health measures of wearing of masks, of keeping physical distance, of avoiding congregate settings. So I think universities, because of the respect with which universities are held by their example, number one. And number two, by getting vaccinated when vaccine becomes available to you. Another example of doing things representing what the most optimal way to do things are. So continue to implement your public health measures, and when vaccine becomes available, go get vaccinated.
Well, I will say I'm incredibly proud again of this town gown partnership and the other leading institutions in our localities. We have built together, led by the city of Williamsburg and James City County, the ability to vaccinate about 3,000 people a day. So we can move through fast, really, really efficiently when the vaccine supply is ready. We are ready. We can turn that spigot off.
I'm glad to hear that. Yeah.
What role do you think we play as universities in preventing future pandemics? We hear a lot about this is not the last. We need to learn from this. What can we learn, and what role can we play as a university in that?
Well, you can train the people in your university to go into those kinds of sciences, which are going to be very important in planning and prepping against future. And that's everything. That's for people who go into not just being physician scientists, but public health officials, administrators, people involved in environmental health. I mean, outbreaks, most people don't appreciate. 75% of all the new emerging infections are zoonotic. They come from an animal reservoir and jump species to a human. So veterinarians, people who study animal-human interface, all kinds of things like that are important.
Mm-hmm.
So I guess looking outward and coming back up to this bird's eye view of this situation, Dr. Fauci, what does the US and the world, what will we look like in a year? What will be the state of our public health then?
Well, where I would like to see it be is that we have this outbreak under control and it is no longer the threat that it is. I believe we're going to get there within this calendar year in the United States. But the problem is, Tony, that a global pandemic requires a global response. And if we don't participate as the other developed nations in the EU and in the UK and in Canada and Australia, if we don't participate in a program, it has a name, it's called COVAX, a program that helps to provide vaccines for the developing world and those regions of the world that don't have the resources to be able to make and distribute vaccines on their own, then our problem will never go away. It will always be a threat, because as long as you have COVID and SARS-CoV-2 circulating throughout the world, it will continue to evolve and to mutate and to develop new variants, which will always be a threat to us. So it's a two-phase thing. Get it under control in the United States and be an important part of the effort to control it globally.
And I guess to that point then, how will our norms change? Should we expect to continue to wear masks when we're sick? What changes or additional impacts in the future do you see these new COVID strains are having on daily PPE practice and social distancing?
Yeah, I think what will happen, though it is conceivable that as the years go by, our corporate memory will weaken and we'll forget what we've been through in this most historic outbreak now. But I would imagine that we're not going to get completely back to the way we were, at least for a while. I think people were going to be very sensitive towards the spread of respiratory illnesses. And I would imagine that fast forward a couple of years from now, and we have SARS-CoV-2 behind us, that you and I, when we are in the middle of a winter and there's a lot of people sneezing and coughing around, I'll bet you several people that you would not have imagined would have worn a mask 3 years ago will be wearing masks. Very much like when you go through Tokyo or Hong Kong or Beijing, see a lot of people wearing masks way before COVID. They just wore it because it was felt to be courteous that if you have a cold or you're in the middle of the winter, that you don't infect someone else. I think that's going to linger on after we get COVID under control.
So on that, would you recommend we continue some of these adjustments we made to our everyday lives to stop the spread of viruses like the flu or anything else that, has a season, can get out there and can infect people?
I think so. I mean, and a typical example of that is that when in the summer, our summer, which is the winter in the Southern Hemisphere, namely Australia and Argentina. Well, last summer, when we were going through this terrible situation that we still are going through with COVID, my colleagues in Australia called me up and said, Tony, something strange going on. We're not seeing any influenza. We're not seeing any respiratory syncytial virus. We're not seeing any parainfluenza. They think the reason is, and they were absolutely correct, that by wearing masks and doing physical distancing and avoiding congregate settings to prevent COVID-19, they were secondarily preventing influenza, respiratory syncytial virus, and paraflu. And guess what? That's exactly what's happening in the United States. We're having an extremely low flu season this year, much lower than we've had in a long time, simply because a lot of people are doing things that by trying to prevent COVID-19, they're actually also preventing flu.
I guess my last question, and something that students are really passionate about and thinking critically on as we examine the future, and thinking beyond the public health consequences and the very obvious economic consequences that this pandemic has had on our societies, are there other consequences such as environmental or ecosystem threats, social issues, et cetera, that we should plan to deal with as a result of COVID-19?
Yeah, I mentioned indirectly a few of those just a little bit ago. I think, the human-animal interface we need to pay attention to. I think obviously climate change, which perturbs, various seasons and mosquitoes and the range of mosquitoes and those vector-borne illnesses. So the environment has a lot to do with it and how we encroach upon the environment, which is always one of the factors involved. I mean, Ebola itself, right now there's a mini outbreak in Guinea right now. I mean, I've been through multiple Ebola outbreaks, in the Democratic Republic of the Congo and in West Africa. And right now it's happening because when people encroach upon the forest environment with bats and with other animals, that's how you get outbreaks of diseases like Ebola.
I want to ask, I'm just thinking about the lessons that we're learning at William & Mary right now, tremendous lessons in adaptability and evidence-based decision-making in spaces we've never been in before, moments of real boldness and also real risk because of the care that we take for our community. One of the things that happened for leaders under pandemic is that it brought sudden and tremendous demands to all levels of leadership. And few of us have had direct experience of these kinds of challenges before we started. Really, they are once in a century for most of us. You're different though, because you have spent your life thinking about epidemics. And I remember the impact of your work in the AIDS epidemic. So I'm wondering if there are lessons that you've learned from that earlier work with AIDS or other epidemics that you have applied in this crisis.
Oh, absolutely. I mean, the idea of, I think you used the word leadership. You know, what are some of the manifestations of leadership? Being able to take charge of a situation, to analyze it quickly, and to respond in a quick and appropriate manner. I mean, those were things that were held true for HIV/AIDS, that have held true for pandemic flu. They were true during the anthrax attacks back at 9/11, and they're true in many of the other things that we've been confronted with. Um, yeah, there are a lot of lessons. Also, the issue of public responses and getting the community involved when you're dealing with a particular pathogen, in this case, a virus. You know, we learned the importance of community involvement in HIV, the activist community, which played such an important role in transforming how we think about the impact of outbreaks and pandemics on the community. We learned those lessons and they paid off very, very big for us with other diseases.
Mm-hmm. All right, I'm going to shift us knowing that there's just a few minutes left to our lightning round. And I'm going to start with one I can't help but ask you, because this is a liberal arts university, how did your humanities degree prepare you for the work that you're doing?
Well, you know, I think it prepared me as much, if not more, than my scientific training. To be honest with you, that sounds somewhat paradoxical, but it's true. I mean, I had a very unusual course in pre-med. It had an interesting name that's sort of like oxymoronic. It was called Bachelor of Arts, Greek Classics - Pre-Med. So I took a lot of credits in philosophy, many credits in philosophy, Greek, Latin, Romance language, and then just enough science to get me into medical school. And I think understanding civilizations, understanding mankind, understanding a variety of aspects about the humanities was as important as the biology that got me to be able to do science, because of understanding the complexity of issues that go into outbreaks, about how humanity responds to outbreaks. I mean, to know a lot about the human psychology and the human spirit was as much as knowing about human physiology. So I wouldn't trade that for anything.
One of the things that's been so amazing in watching you navigate this pandemic is how calm and measured you are in the way you speak and the way you think. So we're really deeply curious, knowing also how incredibly busy you are. How do you maintain that calmness? How do you keep yourself on an even keel during such a difficult year?
Well, I don't think I could analyze it totally, but it's things that sort of come naturally, I'd have to say. But one of the things that I think is an important issue is that I focus like a laser beam on what my responsibility is, what my job is, and what I have to do. And when you focus on the importance and the seriousness of it and realize that by not staying calm, that is only a distraction, that you are much more efficient by being very cold and calm and calculated. And by cold, I don't mean lacking in empathy. I mean not getting angry at something, and that doesn't help anything. And as you probably know from what I've been through over the last year, it's been a little bit unusual dealing with the political explosions that we had to go through. But if you let that distract you, it really is detrimental to getting your goal accomplished. So that's what I think is the reason why.
Well, I do hear the empathy for human experience and everything that you say, which is one of the great sources of your authority. Absolutely. I'm interested, this is my last question for you, in maybe what one thing are you most hopeful for in the future?
Well, you know, one of them is medical and one of them is just more, I wouldn't say political, but it's more outside of the field of medicine. One of the things that was extremely frustrating and painful to me in trying to get the country to do the right thing in response to this terrible outbreak was the fact that public health issues got entangled in the profound divisiveness in our society. And, when you're dealing with a common enemy, which is the virus, it is very counterproductive to be divisive over virtually everything you do. I mean, when really public health issues took on a political connotation, like when wearing a mask became a political statement, that's ridiculous that happened, but it did. And I think that accounted for the lack that accounted for a less than optimal response that this country had, was the extraordinary disagreements that were based not on facts and science, but were based on political differences. So, if there's anything that I hope in the future doesn't happen again, is that we don't get a public health crisis that gets entangled in political divisiveness, because that's very counterproductive.
Well, I will say we have been able to counter that in the Williamsburg and James City County community, broadly speaking, the whole community. And it came from pulling together around care for each other. So Students for Neighbors, City Council for the university, for our businesses, small and large in the region, and for those who are on the front lines in healthcare, to whom we're incredibly grateful. Thank you. I know you're so busy. And it's just a pleasure to be thinking out loud with you in this way. We've been looking forward to it for a long time. So thank you for joining us. Any last words, AJ?
And again, from Tony to Tony, you are welcomed here anytime. And not just because you are the Dr. Fauci, but also because of your classical studies. You'd be right at home here anytime.
Thank you, Tony. Good to be with you. Thank you, Madam President.
So we'll sign off, as we always do, by saying, stay well, William and Mary.
Thank you.